Chloe Litzen-Brown holds multiple nursing degrees. Once working as a pediatric intensive care nurse, it was a career she loved until the stress of the job became too much to handle.
So I was 25, 26 years old, and I ended up so burnt out and sick that I actually ended up on disability.
Now in her early 30s, she's an assistant professor at the University of Portland and focused on looking into this issue. She's not alone in leaving within the first few years. According to a national survey of the last year, around 1 in 4 nurses left their jobs within the first year. Her research found some of the main reasons: burnout, managerial issues, lack of peer support, and moral distress.
Because if we catch them early and we start talking to them about these important issues such as moral distress, preparing for what they're going to see in practice, when they go into practice, they're less likely to have this reality shock in which they go in and they're absolutely unprepared to see nursing the way it really is.
Hospitals nationally have seen their openings jump in recent years, from 8.2% in 2017 to 9.9% in 2020. Locally, OHSU has 257 nursing openings as of November of this year, compared to 114 at the same time in 2019. Legacy Health has 437 RN staff nursing positions currently open. That's double what they normally have. Most are full or part-time positions. Kevin Mealy is a spokesperson for the Oregon Nurses Association. He says this current shortage was something they saw coming. The pandemic just kicked it into high gear.
We had done a lot of good prep work where our problem was going to be small. We were looking at a leak of nurses, and we might be able to replace that leak. Now what we're facing is a flood of nurses leaving the profession and a much greater need.
So what's causing this immediate vacancy? The answer might seem obvious.
We have an overburdened workforce. We have asked so much of our healthcare workers as a society over the last 2 years. And some people have simply said, it's enough.
And because hospitals are a 24-hour business, they can't just close because they don't have the staff. So they are spending large amounts of money on temporary staff, like traveling nurses.
If you can't retain nurses, then bringing in more of them isn't going to fix the problem.
And it's not like there's a shortage of people wanting to become a nurse. It's actually quite the opposite. At multiple nursing schools in the area, they are getting more applicants than they have spots available for. But the lack of clinical placement and faculty are a large part in why more nursing students aren't getting accepted.
So this is really going to become a longitudinal issue if we don't do something about it now.
So the big question is, how do we fix this issue? Well, the Nurses Association says communication is key. They want managers to listen to employees that are on the front lines. Secondly, they say, is pay. They say if you're willing to pay a traveling nurse more money, why not put that towards the ones you already have? And the Hospital Association says we need to expand the education programs to meet the needs of hospitals. One idea floated: increase professor pay. Again, not all easy fixes that will happen overnight.